Should you be waking up with morning erections, and how often should they occur? It might seem like a trivial or awkward topic, but the presence or absence of morning erections is a powerful indicator of a man's overall health. Morning erections, medically referred to as nocturnal penile tumescence, are an entirely natural phenomenon. They occur not necessarily because of sexual arousal, but due to a combination of physiological functions that are tied to the sleep cycle. These erections are most common during REM, rapid eye movement, sleep, the phase of sleep when dreams occur and when brain activity is heightened. During REM sleep, the body undergoes a cascade of neurological and hormonal changes. One effect is a surge in blood flow to the genital area, causing spontaneous erections in men. These episodes often occur multiple times per night and may last anywhere from a few minutes to over half an hour. In fact, studies have shown that men, even as young as 3 years old, begin experiencing these nocturnal erections. They peak in frequency and duration during adolescence, when hormone levels surge and sexual maturity sets in. The research, What Science Tells Us, a landmark study conducted in 1975, evaluated 125 healthy males between the ages of 3 and 79. They were placed in a sleep laboratory for 3 nights while being monitored with tools that recorded brain waves, eye movements, and penile rigidity. The results were groundbreaking. Children aged 3 to 9 already exhibited frequent nocturnal erections. Teenagers experienced the most intense and prolonged episodes, with REM-related erections occurring up to 40% of their total sleep time. After puberty, this percentage gradually declined and stabilized around 20% of total sleep, which equates to 1.5 hours per night on average. Most adult males experience 3 to 5 erections per night, each lasting between 25 to 35 minutes. Another modern study involving healthy, sexually active men between 20 and 60 years old confirmed that these patterns persist throughout life. Even men in their 60s were found to experience regular nocturnal erections. While the blood flow intensity decreased slightly with age, dropping from around 268% of baseline in their 20s to about 200% in their 50s, the frequency and duration remained relatively stable. This means morning erections don't disappear with age. Rather, they evolve. If they vanish completely, it might signal a deeper health issue that shouldn't be ignored. Why morning erections matter? Morning erections are more than a quirky byproduct of sleep. They're a vital sign of health. Their regular occurrence depends on a trio of bodily systems. Vascular system. Blood vessels must be open and healthy to allow blood to flow freely to the penis. Nervous system. The brain and nerves must communicate efficiently to trigger the process. Endocrine system. Hormones, particularly testosterone, must be in balance to support the cycle. When one or more of these systems is impaired, morning erections may decrease in frequency, firmness, or disappear entirely. This makes them an early warning signal for potential issues like erectile dysfunction, cardiovascular disease, diabetes, or insulin resistance, low testosterone, hypogonadism, neurological disorders, sleep disorders, e.g., sleep apnea. Recognizing changes in your body's natural rhythms can be the first step in preventing more serious health problems. What if morning erections are declining or missing? If you're under 60 and you rarely or never wake up with morning erections, consider this a red flag. The absence could be your body's way of pointing out that something is out of balance. Begin by consulting a healthcare provider. A thorough evaluation should include hormone testing, especially testosterone, as its levels are tightly linked to nocturnal erections. Cardiovascular health check, blood pressure, cholesterol, and glucose testing to detect early signs of heart disease or diabetes. Sleep study. If you're experiencing poor quality sleep, excessive snoring, or fatigue, you might have undiagnosed sleep apnea. Lifestyle habits that support healthy erections. Fortunately, there are steps you can take to encourage and restore healthy morning erections. These habits not only support sexual health, but also enhance total body wellness. 1. Prioritize sleep quality. Aim for 7 to 9 hours of sleep per night. Maintain a regular sleep schedule, even on weekends. Avoid screens and heavy meals before bed. Treat conditions like insomnia or sleep apnea. 2. Maintain a healthy weight. Excess belly fat lowers testosterone and increases estrogen. Obesity is strongly linked to erectile dysfunction and low libido. 3. Exercise regularly. Combine aerobic exercises like walking, swimming, cycling with resistance training, weights, or bodyweight workouts. Just 30 minutes of exercise 5 days a week can significantly boost blood flow and testosterone. 4. Eat a balanced diet. Focus on heart-healthy foods, leafy greens, berries, nuts, olive oil, lean proteins, and whole grains. Reduce sugar, fried foods, and processed meats. 5. Manage stress. Chronic stress increases cortisol and decreases testosterone. Try meditation, deep breathing, journaling, or therapy to manage mental health. 6. Cut back on alcohol and avoid smoking. Both alcohol and nicotine restrict blood vessels and impair nerve function. Moderation or complete cessation can reverse some damage. Long-term benefits of monitoring morning erections. Tracking your morning erections over time can serve as a daily health barometer. Many men report noticing other symptoms, such as low energy, poor concentration, weight gain, or low libido, only after their morning erections became infrequent. Taking action at the first sign of change gives you a chance to make small, effective interventions before larger health problems set in. Addressing sleep apnea can restore both REM sleep and erectile quality. Correcting low testosterone can improve mood, muscle strength, and sexual function. Managing blood pressure or blood sugar can preserve nerve health and prevent vascular damage. When to seek help. If you've noticed a significant decline in morning erections for more than 3 to 4 weeks, and it's accompanied by fatigue, low sex drive, erectile issues during intercourse, weight gain, or loss of muscle, then it's time to consult a medical professional. The earlier the intervention, the better the outcome. Morning erections are one of nature's simplest, most consistent ways of signaling male vitality. They reflect the inner workings of your blood vessels, hormones, and brain. Paying attention to them isn't vain, it's smart. Don't ignore the signs. Whether you're in your 20s or 70s, your body is giving you data. Use it. And if something feels off, take the opportunity to investigate and act. Small lifestyle changes can lead to massive improvements in your health, energy, and confidence. Morning wood might just be the wake-up call your body uses to keep you thriving. Stay strong, stay attentive, stay well.